Implant dentistry, from consultation to final restoration. Implant dentistry has transformed the practice of dentistry. It provides patients with an alternative to tooth loss. From consultation to final reconstruction to final restoration, getting dental implants may be life-changing for those who have lost a few teeth. In this clip, we'll go over the many stages involved in implant dentistry and how they affect the success of placing of dental implants. Consultation. The first step of the process of obtaining dental implants is a consultation by a certified implant dentist. At this time, the dentist will examine the health of the patient's mouth and assess if they're a good implant candidate. The amount of bone density in the patient, their overall health and hygiene routines will be considered before recommending the procedure. If the patient is determined to be an appropriate patient for dental implants and the dentist creates an individual plan of treatment according to the patient's specific demands. The procedure may include taking x-rays of the patient's teeth, taking impressions and photographs of the patient's mouth as well as jawbone to confirm that the implants are correctly for maximum function and appearance. Implant placement. When the treatment plan for you is finalized, then the next step will be the surgical placement of dental implants. The procedure is generally carried out under local anesthesia in order so that the patient is comfortable throughout the procedure. The dentist makes an incision through the gums to expose the jawbone beneath and then make a tiny space for the implant be inserted. Dental implants are placed into the jawbone. It is left to heal over 3 to 6 months. The bone begins to fuse with the implant by the process of osseointegration, providing a secure basis for the final dental implant. Final restoration. When the healing process has ended, after which the final dental restoration may be attached to the dental implant. It may require connecting a bridge, crown, or denture onto the implant to bring back its function as well as the aesthetics of the smile of the patient. The final crown or bridge is customized to make sure it is in natural alignment with the patient's gums and teeth. Maintenance and care. When the dental implants are placed, it's essential for patients to keep regular oral hygiene in order to extend the lifespan of the implants. Brushing and flossing often, in addition to regularly attending dental exams to assess the condition of implants as well as adjacent tissues. In certain instances, additional procedures, such as bone grafting or gum transplantation, may be needed to guarantee the success of the dental implant procedure. The procedures will help increase the overall dental health as well as give a firm foundation to implants to grow. Implant dentistry provides a lasting alternative to tooth loss that allows patients to restore their function as well as aesthetics for their teeth. From the first consultation until the final dental restoration to the procedure of obtaining dental implants is meticulous preparation and implementation to ensure the effectiveness of the procedure. Working with an experienced implant dentist and adhering to proper instructions for maintenance and treatment, patients will enjoy the benefits of implants over the years.